Remember, we got a progressive America out there, and they want certain things they want answered. If you don't mind, I just want to pose you a question. We have a website called www.progressivecongress.org, www.progressivecongress.org, and this is folks who want to talk to us, right? And they posed a question, and the question was, doesn't employer-funded health care help to make American business less competitive globally? Would you like to respond to this question?
Absolutely. If you think about the cost of an automobile, which a lot of people do think about, and you know, we certainly want to encourage people to buy American cars, but there is now more cost for health care than there is of steel in that car. So clearly, we have to find a way to get these health care costs under control. And one of the best ways to do that is to have an efficient and quality public plan. All of these public plans that we have, Medicare, Medicaid, Veterans Administration, the administrative costs are very low compared to the private insurance companies.
What is wrong, and I think as progressives we do have to address this question, what is wrong with just having single payer? And let me just say, 2,275 people wanted to know that, and that was from www.progressivecongress.org. Progressive Congress is one word.
And I have been a single payer supporter.
We need a universal single payer system, but if we can't get it now, let's get a system where you keep your insurance and we have a public option.
You know, Americans, we like competition. We want to see competition between a transparent, accountable public insurance option and a private option. And believe me, if people like their private option or their private carriers, then the option, that's what it is, it's choice. They can keep it. If they are satisfied, they ought to be able to keep it.
Another question I had is, why do insurance companies have so much input into the health care reform debate? That's 1,704 people asked that question. Again, why do insurance companies have so much input into the health care reform debate? Do any one of you want to grab that one?
Well, I'll make a stab
Young lady
at
from
it.
California,
They are organized. They have associations. They have a lot of money.
Let's face it, as we push for a comprehensive health care for all Americans, the people who are profiting from the system as it is are going to be out there pushing against us. They're out there now and saying that it's unfair and it's not right, that they should have to compete. Come on. They have had the market to themselves for all of these years, and here we are right now with a crisis in our country in health care.
Mind if you want to take another question?
Sure.
Yeah. Okay. Here is an important question people have. Why can't the public have the same insurance that members of Congress have? 953 people wanted to know that.
Well, actually, that's exactly what we're talking about, making sure that everybody has a plan at least as good as the members of Congress. It can be even better.
So you can ask another question.
Ditto for me.
Ditto. Okay, well, I'd like to just put this one out to you. What is it going to take for you, I think they mean us, to wake up and smell the catastrophe that profit health care is?
Let me just say something. First of all, I don't know what a catastrophe smells like, but I think a lot of people out there are getting that whiff, you know, of what wreckage the current so-called, we don't really have a health care system.
No.
It's kind of a hodgepodge.
So it's all very non-transparent, and that's why the Progressive Caucus is supporting a public insurance option that is accountable, that is transparent. Believe me, those two adjectives do not apply to the private insurance carriers.
We want to create a partnership in the Progressive Caucus with Americans who want real change in health care. And I want to, as a progressive, and as a community organizer, still having that mindset, one of the things that we do as progressives is engage grassroots support.
Yeah.
And that's one of the great things about our website, too, is that they can talk directly to us.
And this has been the Congressional Progressive Caucus, and you're going to take us out.
Health care is a right, not a privilege, and everyone in our country deserves quality, affordable health care with choice.
And I think that pretty much does it. This has been the Progressive Caucus with the Progressive Message, and we'll see you next week. Thank you very much. We yield back.